Hey everybody, my name is Dr. Scott Giacomucci, and I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations. And today I want to talk a bit about Chapter 7 in this book, which is focused on the third of the 6 trauma-informed principles outlined by SAMHSA, which is peer support. So this chapter is titled Peer Support in Group Therapy, Psychodrama, and Organizations. And in any discussion of trauma-informed principles, it's important that we keep in mind that these 6 principles really go together. We can't fully talk about one of them without considering the other. So while this chapter is devoted to the third trauma-informed principles, it would be important to check out some of the other videos and reflect on the other 5 trauma-informed principles as they relate to peer support. Of course, trauma is inherently disconnecting and isolating. And it often leaves us with symptoms and effects that make our relationships really difficult. This is especially true when we experience relational trauma that takes place in the context of relationships. It can disrupt our ability to feel safe with others, to trust others, and to engage in any kind of social support or peer support. Trauma creates a disconnection between self and others. It impacts our attachment styles, our template for relating to others. It can leave us with a sense of mistrust for others. And it can make us more prone to relational reenactments, where we tend to unconsciously reenact unhealthy relationship patterns from the past. It can leave us feeling alone and isolated, like we're detached from others, or how could anyone possibly understand what we've been through? Or maybe we have so much shame and blame ourselves for it. We feel like we're worthless and don't have anything to contribute to relationships. Trauma can result in a sense of helplessness and worthlessness, feeling like we have nothing to offer the world, that we're no good. It creates an unbalanced relationship. When we experience trauma, there's a power dynamic that gets unbalanced between a victim and a perpetrator. And this power dynamic can really leave one feeling unsafe and unsettled, disempowered. So it makes sense that SAMHSA would elevate peer support to the third trauma-informed principle, and that peer support offers a remedy for a balanced peer-to-peer connection that can promote a sense of worth and empowerment. Now, in talking about group therapy and peer support is the third trauma-informed principle outlined by SAMHSA, and it's particularly important in group therapy as well. Of course, our sense of self is really developed through our relationships and our experience with others. And through our experiences with others and our relationships, we develop these internalized versions of others, or we internalize messages about ourselves, about the world, about relationships from our experience with others. The field of interpersonal neurobiology is really highlighting just how much our brain and our mind develops in relationship to others. So when a trauma survivor sees themselves mirrored and respected and valued in the eyes of others and in group therapy, it can almost reawaken a part of the self, or help a trauma survivor reclaim a part of themselves that's been denied or amputated, to try to distance from the trauma, to distance from the pain, or the part of self that's carrying the pain or the burden or the trauma. Group therapy gives us a chance to experiment socially, to rediscover and redefine who we are in relationship to others. Through connections with others, we reconnect with ourselves. And peer support is one of the most important aspects in most group psychotherapy modalities, if not the most important aspect. In the social work with groups tradition, we call this mutual aid. In 12-step programs, they talk about there's nothing as powerful as one addict, one alcoholic helping another addict or helping another alcoholic. I mean, the power of peer support is really core in many self help programs and many group psychotherapy modalities. In psychodrama, specifically, group work is fundamentally grounded in the importance of social connection. It offers group members an opportunity to practice social skills and experiment socially, to learn in action from the role modeling of the leader and the other participants, to renegotiate those core attachment styles that are developed in childhood. This sense of group belongingness that is cultivated in a cohesive group is a remedy for isolation. In many ways, group work is more powerful and more potent in this regard than individual work ever could be. There's a sort of healing nature that comes from peer support, from group cohesion, a sense of belongingness and mutual aid that is only accessible in group therapy and group work that's just not possible in individual work in the same way. When a group comes together with a shared goal, it helps everyone realize that they're not alone. It provides a sense of solidarity and a sense of a collective moving towards a shared purpose and a shared goal. Helps people feel like they're not alone. In the group, the painful experiences of the individual become normalized by the group sharing their experience. There's this all in the same boat phenomenon that emerges. Some people, group therapy might be the only time that they've connected with others who've experienced the same or similar traumatic experiences. And we can't underestimate the power of that. The validation from one peer to another peer that's experienced the same or similar trauma is often more powerful than any validation that a therapist or professional could offer. Some trauma survivors may need to first learn how to trust peers before they can learn how to trust a therapist or somebody that has power over them again. And this is something that we'll see often for folks that have experienced complex trauma, especially. The experience of peer support in group work is helpful for both parties engaged in the peer support process. The person receiving the support gets to receive help, care, empathy, new insight and perspective, new practical suggestions, new information, and support. The person offering the support leaves the interaction with a sense of pride that they were able to help someone else, a sense of value in themselves and their past experience, a sense of competence in their ability or self-efficacy in their ability to help others, empowerment, maybe even a sense of post-traumatic growth, enhanced respect for themselves and self-esteem. Mutual aid and peer support promotes role versatility in that participants in a group learn how to shift between being in a role of providing help and being in the role of receiving help. So it really can help people get unstuck and to access spontaneity, to access new roles and new behaviors. The collective strength of the group has a greater capacity to hold and integrate trauma and adversity than any single individual participant alone, or even any single therapist or professional. So peer support is particularly powerful. I want to challenge us to pause for a moment and to consider some of the ways that we've seen peer support and the healing and corrective power of peer support in the groups that we've been a part of. How has peer support helped us? How have we seen peer support and mutual aid be helpful for others in the groups that we've facilitated? In terms of psychodrama, specifically, this third trauma-informed principle of peer support is also particularly relevant. Psychodrama allows the protagonist to externalize parts of themselves, to renegotiate their relationships to parts of themselves, and to reintegrate these parts in a newly configured version of themselves. It's almost like in psychodrama, through externalizing parts and through role playing, we can access a sort of peer support between parts of an individual, not just between two separate individuals. Other group members are inevitably going to see themselves in the roles that the protagonist puts on the stage and in the different parts of themselves. And in doing so, it's going to help audience members and the other role players enhance their own self awareness and their own sense of connection to different parts of themselves. There's different psychodrama interventions that can help deepen our connection to ourself. One is doubling. Doubling is the first of the developmental phases in psychodrama's child development. And the intervention is about helping the protagonist express something that's unexpressed, to label something that's been unlabeled, to find words for something that they didn't have words for previously. Doubling helps the protagonist connect with themselves. The mirror position. This is where we pull the protagonist out of the role play and have them watch the scene from a distance. It can help them reconnect with themselves, to see themselves in a new way, to develop new insight about themselves, and to offer peer support through the process. And of course, role reversal is the linchpin of psychodrama and is inherently embodying peer support, in that the role player and the protagonist and the roles as separate entities are engaging in support together. Psychodrama even allows individuals to have a conversation with different versions of themselves. So we could cultivate peer support between the protagonist today and the protagonist as a child, or the protagonist in the future and the protagonist today, and engage in a sort of reciprocal support between those roles psychodramatically. So psychodrama gives us really unlimited possibilities as it relates to redefining the self, reconnecting with the self, and engaging in peer support. There's opportunities for mutual aid in the warming up process in psychodrama, in the psychodrama itself and in action, and in the sharing portion at the end of the psychodrama, where each participant shares with the protagonist how they related to the psychodrama. The use of sociometry, which is primarily used in our warm-up phase, is ripe with social support, peer support, and mutual aid. Sociometry positions individuals in the group to be therapeutic agents for each other. And in doing so, it uncovers the different sociodynamic dynamics within the group and allows us to leverage connections and shared experience and shared identity for everybody's healing in the group. Simply put, we could say that sociometry is an exploration and realization of the potentials of peer support within groups. Psychodrama in a group process really can't happen without peer support. We have other participants in the group play the other roles in the psychodrama, and through their role playing, they're offering a unique type of peer support to their peer, who's the protagonist. Again, in the sharing phase is full of peer support, in that each person is offering their own experience to the protagonist, and in doing so, helping themselves, reflecting on their own experience, and helping the protagonist and the other group members who are listening and receiving that peer support through other participants sharing. Moranian philosophy and psychodrama sociometry philosophy is really explicit in empowering each participant as a therapeutic agent for each other. Moreno writes in 1947 that one patient can be a therapeutic agent to the other. Let us invent devices by which they can help each other, in contrast to the old idea that all of the therapeutic power rests with the physician. So the psychodrama process focuses on the power of the group rather than on the power of the facilitator. And we're using psychodrama and sociometry to position individuals in ways that they can heal each other. So in psychodrama, the healing does not come from the facilitator. The healing comes from the interplay between the protagonist and the other group members and the other roles. So it's really centralizing peer support as core to the process. Of course, in thinking about peer support in psychodrama, in group therapy, and in organizations, we have to also consider the other trauma-informed principles. We really can't integrate peer support without addressing issues related to safety, transparency and trustworthiness, mutuality and collaboration, empowerment, voice choice, and issues of identity. So I encourage you to also consider these other principles as they relate. Now, peer support is also relevant in organizations, just like it's relevant in groups. So, this third trauma informed principle from SAMHSA, peer support, is particularly relevant for organizational leaders, supervisors, and for professionals, educators to consider within organizational settings and other professional settings. In the same way that peer support is helpful in groups and communities, it's also essential in organizations because the organization is essentially just a group of people coming together. Social support within an organization can help reduce feelings of overwhelm from the workload and occupational stress, which can fuel negative impacts on attendance, well being, organizational commitment, and even employees' intention to stay with a company long term. So, lots of really good reasons to focus on peer support within our organizations, not just moral or social reasons, but also really fundamental, logistical, and financial reasons why it would be helpful for organizations to spend the time to cultivate peer support in their departments and between their employees. The power of two colleagues supporting each other is sometimes even more powerful than a supervisor helping a supervisee. Naturally, there's going to be some topics that a employee is not going to want to talk about with the supervisor. They're going to feel like it's too vulnerable or they're going to feel too ashamed to bring it up with the supervisor. But they might be willing to talk about it with a peer who doesn't have any power or authority over them. In peer to peer connections in organizations, the power dynamics are balanced and level, whereas in supervision, there's a clear hierarchy and an unbalanced power dynamic. In the research on organizations, peer support shows promising positive impacts on workers' confidence, on their self esteem, on their resilience, well being, on their job performance, and even on job satisfaction. Peer support effectively helps to mitigate the impact of secondary traumatic stress and of burnout, compassion fatigue, and vicarious trauma, while helping to cultivate vicarious post traumatic growth in our work. And if you wanted to learn more about burnout, about secondary traumatic stress, and about vicarious post traumatic growth, I'd encourage you to check out some of the other videos on this channel, and specifically chapter 11 in this book. Many staff members in an organization, their primary sense of fulfillment in their job is going to be related to the relationships with their peers at the job, more so than the actual work responsibilities or the organizational mission. And I find this to be true again and again and again, often for myself, for the clients I'm working with, for supervisees, for friends and family members. We spend so much time at work that the relationships that we cultivate at work become really meaningful and a big part of our life. So it makes sense that for many in their workplace, those workplace relationships with their peers are going to be really meaningful and important to them. Peer support can be cultivated in really direct and in indirect ways, including in supervision groups, in peer supervision spaces, in training events, in support groups for staff, peer support programs specifically, professional development initiatives, and in other simple things like having team events or team building events or simply having meals together as a team. Within our organizations, I find it really important that we consider the sociometry of an organization and the group dynamics and sociodynamics that emerge within the organization. And so, thinking about who's connected to who has experience that could benefit somebody else in the organization, who could I put in a position to somebody else in the organization where they could benefit and engage in peer support together, who has things that are important to them, or preferences, or identities, or cultural or religious backgrounds that mirror somebody else in the organization that might promote a new and unique type of peer support. So, in my own organization, in thinking about the sociometry, I'm implementing my sociometric awareness through my hiring practices. And one simple thing I do is I will try to make hiring decisions in groups of two or small groups rather than hiring one person at a time whenever possible, or bringing two interns in at a time rather than bringing one intern in at a time. That way, they get to come in a small cohort, and there's naturally opportunities for them to support each other as peers rather than feeling isolated or coming in and only having support from a supervisor or somebody who's at a different point in their career. We can even think about the positioning of our offices and our workspaces, who were having share offices or who were having be in offices next to each other or in the same part of the building, as promoting or inhibiting peer support even. And if we're engaging in shift work in our organizations, we can think about it in terms of who's on what shifts and the interpersonal connections between staff that could promote peer support on different shifts. So there's lots of different ways we can be thinking about peer support within our organizations. I find that very simply having regular team gatherings, team meals, or norms where team members are coming together for lunch or other trainings and events can create avenues for peer support that don't have to cost a lot of money or be overly formal or pressured, but really create informal peer support opportunities. Creating a work culture where peer support is encouraged within formal meetings, within supervision, and within the workplace really contributes to overall well-being and supporting mental health and work satisfaction. As leaders, we also have to consider gaining our own peer support. Leadership can be really isolating. Many times what happens is an individual will kind of work their way through a hierarchy within an organization, and they'll be in a department or in an organization where they have lots of peers and they develop really important peer support relationships and connections with colleagues. And then all of a sudden they get promoted to the supervisor role. And now they're supervising or responsible for managing the same people who used to be their peers. And all of a sudden they lose all the peer support that they used to have based on this new role relationship that they have to engage in with folks where there's an inherent power imbalance. So being in leadership can be really isolating, especially in smaller organizations where there might not be as many supervisors or leadership roles or managers, and we might have to look outside of our organization to cultivate peer support with other leaders. There's going to be things that as leaders we simply can't share with others in the organization because of confidentiality or privacy, or it's information that would be inappropriate to share about our own feelings of being a supervisor or manager or leader. And so it's important for us to engage in our own peer support outside of the organization as well. In my own experience, I found it really invaluable to do this for myself. So as someone who owns and directs an outpatient trauma therapy center, I connected with a colleague and developed a friendship with a colleague who runs almost identical, a very similar outpatient group therapy center nearby. And we have a meeting once a month on a somewhat regular basis where we come together simply for peer support. And usually we take half of the meeting and we split it up into two parts. And either I'll get the first half of the meeting to talk about and ask for support around whatever I need support on, and then she'll get the second half, or vice versa. And we kind of split it as evenly as we can, 30 minutes and 30 minutes. Sometimes this involves talking about the logistics of running a business, or legal or financial, or managing employees, or those kinds of kind of logistical things, and engaging in peer support in that way. But many times it comes back to the emotions that we experience as leaders, our fears, our frustrations, our anger, our vulnerabilities, our sadness and loss that we experience as leaders. And having a peer that can support us in that, who understands it, who has experienced similar things, who knows what it's like to own and direct a similar company that I own and direct, has really been validating and really supportive. So I really encourage you as a leader to cultivate peer support relationships within your social circle. And again, you might have to go outside of your organization to do that. So, in thinking about peer support, I want to challenge us to pause for a moment and reflect on, in your own organization or professional circle, who is someone that you could connect with for peer support? Someone you could ask for support from, but also reciprocate and perhaps offer support to. Who's one person? And I want to challenge us to also reflect on how how valuable peer support has been in the past for us, how meaningful our work relationships have been, how that there certainly have been times in the past, I imagine for any and all of us, where there were things that we felt more comfortable sharing with peers in the workplace versus sharing with a supervisor or a leader. And so peer support becomes that much more important in organizations for all these reasons. And again, we can't fully embody peer support without also considering the other 5 trauma-informed principles. So I encourage you to subscribe to this channel, to leave a comment below about what you found helpful, and check out some of the other videos on the channel to learn more about trauma-informed principles in group therapy, in organizations, and in psychodrama specifically.